I found Scott disoriented and very lethargic. I woke him and asked him if he was okay. He told me he was fine and that he just took what the doctors told him to take. At approximately 07:30, I found my husband cold and unresponsive. At 35 years old, this father of two was gone.
I'm the widow of Ricky Green. My husband served his country for 23 years, serving both on active duty status and in the reserves. He was a military policeman and a paratrooper, and he served with distinction in Desert Storm. He retired as a sergeant first class. My husband, Ricky Green, died as a result of the VA's skyrocketing use of prescription painkillers. On behalf of my husband, myself, and our two grieving sons, I want to ask this committee to do all that it can to prevent other veterans from dying in the same manner that my husband died.
I also started an intense opioid pain medication regimen. My life revolved around when is my next pill, when is my next dosage increase, and when can I get my next refill. At my worst point, I was taking enough pills daily to treat 4 terminally ill cancer patients. It had enormous physical and mental effects on me. I was so high on the opioids that my eyes would often roll in the back of my head, and if I wasn't babbling incoherently, I was drooling on myself. My wife stayed by my side throughout the entire process, but for years I went without even telling her thank you for taking care of me. I was not the husband my wife deserved, and I was not the father my daughter deserved, and it was a very dark and difficult part of my life, one of which I'm extremely ashamed of and regret today. With no options offered by the medical services, and after seeing a video of myself passed out with my daughter in my lap, I started to look for treatment on my own.
The bottom line in all of them are they are on massive amounts of medication. You don't have to know anything about medicine. You don't have to know the difference between morphine and tramadol and Percocet. All you have to do is hear the quantities. There was a 55-year-old man, the first patient I saw in this musculoskeletal clinic, who had carpal tunnel. I bet you everyone here has had carpal tunnel symptoms. If you flex your hand for too long, these fingers will go a little numb. It is fixable with surgery. This gentleman had the surgery. He had none of the findings of chronic entrapment of the nerve. He had morphine, fentanyl patch, tramadol, Percocet. He had been getting it since 2004. He had not been seen since 2004. He had had no labs checked since 2004. He had the opioids mailed to him. He didn't even have to come in.
What I found was a disgrace. I discovered that veterans' narcotic prescriptions were being renewed month after month, months on end, sometimes for 1 to 2 years, without an examination of the body part that was in pain. They had been seen for routine medical problems, but the pain evaluation amounted to merely asking them to rate the pain on a scale of 1 to 10. This was not just a few of the nurse practitioners whose patients I saw. It was the rule rather than the exception. Often there were no x-rays, no recent MRIs, no tests, no specialist consultations for the pain problem, just more and more narcotics on top of other medications. There was no true attempt to screen for misuse or drug diversion. I found that urine tox screens were infrequently done, and often they were positive for substances like cocaine and pot, or negative when they should have been positive. Many of the vets were misdiagnosed. Some had potentially serious conditions. Pain contracts were not being completed. When urine drug screening was done, no one even checked to see if the specimen was body temperature or if the specimen was even from the veteran. No one was bothering to call the state databanks to see how many providers in the state were giving the people narcotics. I'm here to tell you that this is just not a problem at Jackson. It's endemic throughout the VA, where quick and cheap is rewarded over good and thorough. Furthermore, it is not uncommon for a doctor to refuse to write a narcotic prescription only to have the vet go to the administration. What happens? The administrators call another doc and tell them to write the prescription, or the vet will go to the emergency room to get their narcotics. Worse yet, doctors are being verbally abused, attacked, or injured when veterans who are in dangerous concoctions of mind-altering substances are cut off. In Jackson, a doctor was shot and killed. Another one had acid thrown in her face. In Delaware, 2 mental health workers were attacked. A vet who was denied narcotics ran his truck into the VA clinic in Lincoln, Maine. Another vet in Maine attempted to enter the VA with a gun to shoot the administrator. He became a case of suicide by cop. Why is this happening? Unfortunately, we have given the veterans the impression that for whatever problem they have, we have a pill to help it. 1 or 2 pills for depression, 1 for anxiety, 1 or 2 for sleep, 1 for PTSD, then add a few more pills for problems like hypertension or diabetes, asthma, then add 1 or 2 or 3 prescriptions for narcotics. What happens if the vet adds some over-the-counter medications, or if he drinks alcohol? We have a prescription for chemical lobotomy, a veteran who is at risk for fatal interactions, someone whose brain is bathed in a chemical soup. The VA will show you guidelines and resources available to providers showing how much they are doing. These are the same administrators that create regulations, mandates, requirements that are so mind-boggling that physicians are no longer captain of their ships.